as well as to me directly, and I'll make sure that we're addressing those questions in next week's roundtable. To get started today, we're going to talk through a few slides and some information that we have to share with you, as well as to me directly, and I'll make sure that we're addressing those questions in next week's roundtable. So right now, we have some information to report on hospital furloughs that are really reaching record numbers. To date, we have heard that there have been about 300 hospitals across the nation that have announced furlough plans this past week. I really believe this number is possibly understated. There are a few things that we really want to recommend to everyone to do as you work through this. Number one, ensure that you have plans that are going to be in effect prior to the furlough, as well as during and then after to recall the staff. As we all begin across America to reposition to reopen elective surgeries and begin business as normal, we're going to have to all really have plans in place within the healthcare industry to make sure we're bringing our staff back and or to making decisions with the right staff as we work through the pandemic response. So really utilize this opportunity at your own organization to revisit processes that you have in place, to look at your minimum staffing levels and ensure that you're comfortable with those levels, identify skill mix and opportunities to cross-train. I've heard stories of everything from physical therapists right now that are actually serving to register patients within outside ambulatory centers for COVID-19 testing. I've heard of situations where they've taken individuals that used to be working in some of the physician practices, and they're now transporting patients at hospitals. So really look at your staff, understand where you have resources that are available to you that you may need to redeploy, and understand what that skill mix and cross-training looks like. And as you're doing that, always make sure that it's rooted in efficiency and looking at productivity expectations, and use this as an opportunity to revisit all of your processes, all of your departments. And if you do that, you can actually push through this pandemic and come out of the other side a lot stronger than you are currently. So always use everything as an opportunity to revisit and an opportunity to look at how you can improve your processes. So there are a few alternative steps that we always want people to consider. And I had a conversation with a client about this earlier. And the discussion really was, we want to avoid furloughing our employees at all costs. We know we're going to have to furlough some level, but we want to keep the number as low as possible. So the conversation really focused on, okay, what else can you do? So in those cases, you might want to look at any contracts that you have with your collective bargaining agreements. Within those CBAs, some of our clients have clauses that allow them to reopen the negotiations in the event of a crisis or in the event of a pandemic. And if you find yourself in that situation, I would definitely encourage you to seek legal counsel and look at those opportunities that might be available for you there. We've also had some hospital clients and healthcare systems that have looked at shortening work weeks in some of their clinics that are not full capacity right now. They've looked at altering the shifts by both the time that they're operating as well as the days of the week. So you can always look at the volume that your patients are coming into your clinic right now, determine how you can shift your resources, and then adjust as necessary. And as we know, there are a lot of telehealth components that are coming in right now, which gives you the opportunity to really look at how you're deploying your resources and see if you can shift that as well. We also have seen some areas that have done temporary shutdowns. These are occurring more in service lines that have really gone to zero volume visits right now. So this is not the norm within healthcare, but in some of those more elective procedure areas like plastic surgery, we have seen some temporary shutdowns. And as the country reopens, there's going to be staged approaches to all of this. I would encourage you to look at things like reductions in overtime and also any other contract renegotiation that you can do with some of your purchase services. So if you are in the midst of furlough preparations, which a lot of our clients are and a lot of hospitals are, I really want you to really focus in on making all of your decisions based off of your decisions and articulating your business needs. So really stick to your mission. What is your hospital trying to do? What is the mission that you're serving? Where are your key priorities right now? And then make sure you keep those intact, as everything's always rooted in our mission. As a healthcare leader, our mission tends to be to provide services to the communities that we serve and make sure that we have the highest possible quality that we can deliver. So with that in mind, always put forth your plans, ensuring that your hospital is doing everything that you possibly can to meet that ongoing mission. So along with those, look at your facilities that are going to be affected, determine the units and the shifts, really segment out service lines. Something that a lot of you might be interested in next week is we are going to have a representative from a local Pittsburgh, Pennsylvania company, Core, is on with us, and they're going to really focus in on how you restart service lines. Services such as orthopedics, neurosurgery that have been severely impacted by the pandemic are now starting to get their rebuild plans in place. And how do you restart? Make sure you're following all of the guidelines that are in place. Make sure that you keep your staff and patients safe. So they're going to talk about some of the protocols and things that they're doing right now next week on this same roundtable. As you're working through the pandemic, talk about what job functions you're going to be eliminating. Make sure you know what job functions remain, and always assign the individuals that are responsible for those job functions. One of the biggest mess tips that organizations take during either reductions in force or furlough plans is they don't necessarily understand all of the job functions that the individuals that are no longer there did. So before you actually execute, make sure you understand every single element of people's work roles and who's going to be responsible for actually deploying those jobs in their absence. Understand who can perform those remaining job functions, and is there any training that you have to have before you actually make those plans effective? As you're doing this, always stay rooted in the selection criteria, the selection process. Make sure that you follow all guidelines that you need to from a legal perspective. And the most important point of our furlough process right now for hospitals is you need to understand the recall plan. As the volume starts to come back into your hospital, into your service line, into your practice, into your area, how are you going to know the trip points when you're going to bring your staff back on board? And understanding those is going to be vital to your success moving forward. So along those lines, what we're recommending to our clients is that you really build out some plans to do that. And what we're looking at are some considerations, along the lines of, as you're looking at your productivity targets, you're going to want to look at things such as, your median performance levels, your better performance levels, and best practice. And we can help you with that analysis if you need new comparatives. One of the areas the majority of our clients have been reaching out to us for over the last week or two is physician practices. As we all know, the physician practices have moved more to virtual appointments recently. We've had clients that have reported that as many as 90% of their visits now are virtual. That's great from a telehealth perspective, but what does it mean to your labor reports? What does it mean to your labor compensation, to your skill match, to your productivity targets? What we're helping our clients do is identify the percentage of their visits that are virtual right now compared to office. What's that going to look like on the other side of the pandemic? And then as you go from 90% virtual to possibly 40% virtual, how does that really impact your skill mix? So as we focus in on this, we're really weighting targets for our clients based on those comparative staffing patterns. We're updating all of our expectations there and really building that rebuild plan. So when 25% of the volume is rebuilt and you're at that level, what should you have? When 50% of the volume is rebuilt and that level, what should you have? And really stepping into that furlough plan on the other side, and or just your volume growth plan. What are you going to need to sustain? One of the biggest things that we're working with too is how do you shift your provider productivity? There was a big change within the industry where we started to use a lot of extenders. So we had some nurse practitioners that were coming into clinics. We had a lot of PAs that are in the clinic environment. And now that we've moved into more of a virtual telehealth perspective, what is the role of those individuals? So talking through, how you shift your provider responsibility, your provider expectations, and their productivity during this time is going to be crucial, because all of our work has changed. We're, a lot more remote. We're doing things in a different environment, and we need to stay up to date on that. And then finally, as you're dealing with all this, I'm going to segue into, the compliance conversation a little bit that we'll be focusing on today. But as you're looking at your furlough plans and you're really detailing out the compliance and quality related administrative departments that have been impacted by COVID-19, think through some of the areas like public affairs, legal, compliance, risk management, quality, patient satisfaction, and performance improvement. A lot of times, our immediate reaction is that we need to go as thin as possible in all administrative functions. And to some extent, whenever you're really focusing on cost reduction, you're looking at simply keeping the doors of your facility open. That is, of course, important. But the problem is that, if we go too deep in some of these areas where there are public affairs situations or legal situations and compliance situations, you're going to really miss a portion of the work that has to be, completed in those areas. So we want you to really think through those departments. If you're looking for targets and recommendations right now, we can certainly help you with updating all of those targets from a benchmark perspective. But really focus in on considering the impact that any of your considerations have there, your organization's ability to respond to any changes in regulations, any change to laws, and making sure that your hospitals really have the reporting and all the necessary needs that you have in those areas, because there's going to be a lot of heightened need for information dissemination, a heightened need for communication, and a lot of change in all of those areas where compliance is involved. So with that, Natalie, let's really dive in a little bit into what compliance means. One of the things that I'd like to get started with, if you could just share a little bit of your background at a high level, we'll start there so the audience can know a little bit more about you, and then we'll really dive into compliance overall.
Sure, sounds good. And I'll just make the statement right off the bat that, the information and the statements I'm sharing today on this roundtable are my own and are not necessarily reflective of the Veterans Health Administration or the federal government. So with that being said, my background, I originally started in healthcare in the social work side of the house. It's what my bachelor's degree is in. And I did research in nursing homes on quality of life for residents in nursing homes. Shifted from there to go for my master's in health administration and ended up in pediatrics. So quite the shift in the population I was working with, but was the director of compliance, risk, and regulatory for the Children's Institute of Pittsburgh, which is a rehabilitation facility. They also do education for special needs children, as well as social services for children, including the medically fragile. And about 2 years ago, I decided to make the shift out of the pediatric realm and came to the Veterans Health Administration, Veterans Integrated Service Network 4, which is the Pennsylvania, Delaware region, as the Compliance and Business Integrity Officer with additional responsibilities in integrated ethics and the Freedom of Information Act. I come with a background in lean management. I have a green belt in Lean Six Sigma, a certification in public leadership, certified in healthcare compliance, and then I have my fellow with ACHE. So I tried to stay as well-rounded as possible, but in hopes that when you look at compliance, you're not looking at simply the revenue aspect of compliance, but you're looking at it in much more of a broad aspect and how it touches literally every operation of an organization, whether it's inherently visible or it's very much behind the scenes and implied.
That's great. So I think that's a wonderful introduction, and you've had such a diverse background. And I think that background really lends itself to the experiences that you bring to the table in your current compliance position. Let's just talk for a minute about how compliance has changed within the current pandemic. I think that people really had a very narrow hat of what a compliance officer does prior to this, and it was really rooted in thinking from RAC audits and making sure that your charge capture was appropriate and that you weren't overcharging or undercharging, and making sure you weren't the focus of a RAC audit in the future. I think that shifted now. Can you just talk a little bit about how compliance has shifted during this crisis and what it really means to you now?
Sure. So compliance historically is very revenue driven. As you mentioned, it is making sure that we are obtaining as much revenue as possible, but also that we're not doing anything inappropriate and potentially at risk for penalties from the federal government or through CMS or OIG or OCR, and there's a lot of different elements. Compliance also usually includes privacy. It includes some contract oversight, a lot of those elements, and it looks different from organization to organization. However, the one thing that has always stayed true is that audit piece. Sometimes internal audit is a separate segment, but it works very much hand in hand with compliance. What we're seeing now, I think, across the board is because there is so much shifting from a regulatory standpoint, so many waivers being put into place, so many immediate responses that need to occur, that compliance is at this point just trying to keep up and make sure that folks know what is going to protect the organization and also provide the absolute best and most thorough care to the patients that they're serving. So not only safety on the staff and the organization side, but still making sure that if a person and a patient needs absolute care, that we can provide it in a way that is appropriate to them and that is financially feasible in the long run for everyone. We're seeing significant changes in telehealth, Stark waivers that are coming through. The Office of the Inspector General has really shifted their approach. They're doing a lot of rapid cycle investigations, addressing things that specifically involve the COVID response. I think we'll see a lot more. We already have coming out about price gouging and fraud when it comes to outside vendors and how they're manipulating potentially the system. And how do we detect that quickly enough? Because we know that this environment is changing from day to day, hour to hour. So one thing that looked completely fine yesterday is going to look very different tomorrow. And we just have to have that awareness. So compliance is coming forward in a way of not only are we building more real-time detection pieces, we're also trying to anticipate what we need to do in a preventative fashion. Because when things calm down, a lot of these changes may stay in place in some form or fashion. Thinking of telehealth especially. People that were very adverse to using telehealth platforms, whether it be telemodalities, an app, anything like that, now have potentially been forced into utilizing that for their services. And we're hearing from everyone in the country, hey, this really isn't that bad. I still get to see my provider. I still have some type of care that's happening. I can still get prescriptions refilled. And I think that we're going to see less people demanding to come in face to face to meet with their providers and more of this virtual health provision. Now, when the COVID response is done, we don't know what relaxations of HIPAA regulations or telehealth regulations will remain in place, but I think there will be a lot of pressure to move that conversation forward much quickly, which impacts coding, which impacts billing, which impacts contracts with different insurance providers, all of those elements.
Yeah, I agree with everything that you stated there. I think that we're going to move into a period of time where there's going to be heightened interest on telemedicine. And as we know right now, there's a lot of relaxed requirements on telemedicine that have been put forth, and those will be good until the end of the pandemic or whenever that's declared. But after that point, what remains? So that compliance is going to play a role in all of those components. And I think that as we work through some of the OIG regulations and the Stark regulations and some of the other components that we've touched upon, it's going to be changing forever. And I think it's a very exciting time to be in healthcare, but it's also a time where you really have to stay on top of all of the laws and the regulations and the impact that's going to be. And one thing that you touched upon a lot is fraud and abuse. And I certainly agree with you that this is a situation where there's a big opportunity to have fraud and abuse occur, and waste. And we're seeing it everywhere from the price gouging perspective. And it's not just happening with, PPE or the personal protective equipment. We're seeing it in other areas as well. Any place that deals with testing, equipment that's needed to perform the testing, even in construction of just getting some of the hospital facilities up to code to be able to shift and have the necessary requirements there. We're starting to see some things occurring there with just the cost of labor. So it's important to have that compliance perspective from a fraud and abuse piece. And this is something I can't stress enough to our clients and to the audience in general. Please make sure that you're watching what you're paying on places and that you're going through vetted sources. It's really important that you use recommended vendors right now and that you stay things in line. We've had situations where we've had people report that they actually ordered product that was never received. They made the payment but never received that product. So again, make sure you're vetting, use reliable sources, and go through your typical supply chain vendor relationship building process. So with that, let's dive in a little bit into what the VA has been doing with the response. So we're going to push forward into our slide deck here.
Sure. So all of the information I'm going to kind of touch on today is as of today. So like I said, with things changing so much, it's hard to really keep up to speed on everything. And I also just want to state all of this information is available to the public that we're going to talk about. And it's at www.publichealth.va.gov. /N-coronavirus. The link is in the slide, so please, I encourage everyone to go take a look at that. I think also embedded in today's presentation and linked here on this slide is the VA's COVID-19 response plan. This plan really is seen as a best practice guide. It's been made available to the national medical community as a valuable tool to see the step-by-step process that VA has gone through in regards to the response to the pandemic. So for an idea, this is over 250 pages of information. So there's a lot there to digest, but it covers so many specific elements from administration, finance, logistics, telehealth, how this attaches to a mission, screening of patients, testing, all of that is within there. So instead of me trying to rehash every element of that, I'm really going to encourage folks to go take a look at that, review the table of contents, and click down to the sections you feel are most appropriate for your organization. That being said, the VA really implemented a very aggressive public health response. Veterans Health Administration is the largest integrated provider of healthcare in the United States. So you can imagine we're in pretty much every state. We have multiple ways that we're providing care to a ton of different types of individuals with different acuity levels. And not only that, but we had to make sure that we were also responding to the care of our staff, the healthcare providers themselves who are frontline, and those that are caring for the veterans, such as their families. The VA worked hand in hand with the CDC and other federal programs to monitor the outbreak of the virus, and worked, one of the main points I want to highlight on, and we've talked about it, is the shift to telehealth. So moving outpatient care to a telehealth way of provision. Some elective and non-emergency surgeries, of course, postponed. And telehealth is minimizing contact, it's saving time, it's reducing the need for PPE, making resources available for critical use. So in many organizations, outside the VA as well, you know, providers potentially can not be in the bricks and mortar building of the hospital, but providing the care in an improved setting through approved technologies. And that was one of the things. HIPAA relaxed a little bit, telehealth guidelines relaxed a little bit in regards to the types of technologies that were blessed in order to provide teleservices. Next slide. So additionally, the VA has administered over 100,000 tests nationwide. So you can imagine that volume. And, you know, Stephanie, as you mentioned, it's not just providing the test, it's all of the swabs, it's all of the different laboratory pieces that come into play and how quickly those labs can process the equipment and the testing. So it's been quite interesting to see. We run into the same things that everyone else runs into with doing that, but the coordination of those 100,000 tests, and that is increasing daily. We also are doing outreach to staff, clinical screening at VA healthcare facilities, protective procedures, patients admitted to community living centers and spinal cord injuries, you know, getting special attention. We know right now, and I'm sure it's in the news constantly, is the vulnerability of nursing homes, you know, and how affected those residents are in the nursing homes by this virus and how quickly it can spread and the impact to the staff. So making sure that the VA was responding appropriately to community living centers that we have here in our campuses. Also, the VA's fourth mission, which is to support the non-VA healthcare systems in the event that those systems encounter capacity issues. So I've included a few links to examples of what the VA has done in their fourth mission, including in New Jersey, in New York, and additional other areas of the country. And that has been a part of the VA's mission, and just not one that maybe has received a lot of attention because we haven't found ourselves in these situations in the past. But I encourage folks to read up on that and really get an understanding of how the VA serves as the security net when needed in those events and areas. So in general, those are kind of the big bucket areas that we're looking at. It was that need right off the bat, and I'm sure every organization that's seen this has identified emergency management really needing to be an area of focus, and providing that pandemic response and that plan really helped structure the outline for how the VA was going to respond to this, and getting that done as soon as possible, knowing that the VA is in many places in the country where the hotspots were already occurring. So to be a part of that, and incident command and seeing all of that take place, and having that available to the public to be able to read and access, I think is really critical and a great resource for the country as a whole.
Yeah, I think one of the most interesting things about the response to the coronavirus pandemic right now by the VA is really the focus on the fourth mission. We've seen stories across the country, and as you mentioned, those hotspots where non-VA healthcare systems have really needed support. And some of the stories coming out about the response of the VA working with community hospitals has been really remarkable. And I think one of the great things that we've seen come out of this pandemic in general is just our ability as an industry to respond, break down silos, break down barriers, and work together. I know we both are, within the Pittsburgh market. And one of the fascinating things for me has been seeing how AHN, or Allegheny Health Network, and UPMC have come together to really tackle this together. And I think, going back into the VA and that fourth mission, that's one of the most remarkable things about crisis is we break down silos and we break down barriers that used to exist and really unite everyone together towards that common goal.
Yeah, and we hear it all the time. This virus doesn't discriminate against geographic regions, types of people, the name of your organization. It's across the board. So if we remain in our silos and in our own offices and tunnel-minded, it's not going to help us attack this the way that we really need to do so. When we talk about this as a public health crisis, that's exactly what it is. And I think we see that not only, as you mentioned, in organizations coming together and supporting each other, the VA enacting the fourth mission, but also in non-healthcare entities stepping up and going, I can do something when it comes to this. You see convention centers transitioning to temporary hospitals. You see alcohol providers now making hand sanitizer because they have the elements to make it. Clothing companies making masks, fabric masks for folks. So I think that has also been absolutely incredible to see the agility and the flexibility of the country as a whole, so that eases a little bit of the burden off of the healthcare providers who are really the front line in tackling the critical patients that are getting this.
Yeah, I agree. I actually have two pretty good friends that have changed their business models completely. One of them used to make wedding dresses in the New York City area. Adrienne Braun and her company and her husband, they've switched from making wedding dresses now to actually making masks and donating them to the local New Jersey area in New York City. And I have another friend in Rochester, New York, Chris Laniak, whose company Excelsior Printing has shifted to producing masks. So I think we're seeing that throughout the country, which is pretty fascinating. And as all of these components shift and change, I think it's going to be interesting to watch what the evolution of these changes look at. And from a public health perspective, one of the most interesting things that I've seen as well is the sharing of epidemiology information at a level that, in my career, I've never seen. There's just information that's being pulled to us from China, from Italy, from all these different areas where the access to information through the internet and everything is so remarkable right now. And from an epidemiology perspective, digesting all of this and understanding all of this, which drugs are going to work, which response should be best, is just overwhelming in general. So as an industry, I think we're really sitting on a time period where we can make the greatest impact to public health. But to your point on the disparities of health and the fact it doesn't discriminate, how we use all that information is going to be extremely important.
Yeah, I think it's going to open up a lot of discussions, in the near future about the delivery of healthcare and the access to healthcare. We talk about telehealth being a great response to this. Well, what do we do in rural communities where internet access or cell phone service isn't readily available? How do we tackle those that don't have consistent, don't have a smartphone? It's hard to imagine, but there are people that don't have smartphones. The elderly population, that may not have someone there to show them how to utilize an iPad for the first time. So there's lots of elements from an access side of the house that I think that this is making very clear and bringing to the forefront more so than in the past. And that, again, is where compliance is potentially going to help step in and be a part of that conversation. So when we look at, what groups are, delayed in their access to care, are those, timeliness audits that, compliance can help run and look at. So we've got to start thinking outside the box a little bit. There's a really great set of skills that compliance individuals have at organizations that might not even be well known to their leadership team. And it's better to ask compliance, is there something you can do when it comes to X, Y, and Z, and have them say, no, not really, but maybe look over here, versus not ask them. And they were fully capable of assisting in building those supports and those metrics. So I think it's a huge opportunity to open those communication lines and invite those people in to be a part of the conversations as we are so quickly reacting to this event.
And I think, you touched upon a really important point, Natalie. A lot of times, managers, directors, individuals within healthcare organizations might be hesitant or cautious about bringing something to the attention of compliance or bringing something to the attention of quality. And during this time, it's more important than ever to make sure that you share any concerns that you have, because if you do not share those concerns are going to be raised later. And when they're raised later, it's going to be worse for the organization, for the community, for the public health crisis. So this is not a time to remain silent and remain quiet. This is the time to vocalize what you're thinking, what you're feeling, and what you're concerned about, because it will be for the betterment of the organization overall.
Yeah, and that leads me to think right off this is a time, and we think maybe, oh God, we can't put more messaging out, but this is when managers should be dusting off the code of conduct and taking a look at
Absolutely.
it and reinforcing it and reminding folks, hey, we get that you signed this years ago, or maybe it was just updated and you took a look at it last year. This is a chance to really remember the code of conduct that this organization has and expects of their employees. And part of that is coming forward with concerns and doing self-reporting. There is no doubt in my mind that when things calm down and the surveying company organizations can go out with more vigor, that there's going to be a lot of Joint Commission visits, a lot of Department of Health visits, a lot of OIG visits. We've got to prepare for that. And the more that we have awareness of up front before those organizations come in, the more potentially we can handle in-house and address immediately, or we're not caught off guard. And we can say, we know about this. This was the response that we did. And also making sure that we're open for patients and their families to report concerns in as well. There's a lot of times when things might show up on an explanation of benefits that we don't see, but now we need to be aware of. So fielding those calls from the public, as well as our internal stakeholders, is incredibly important. So making sure you've got your hotline posters up throughout the building, that you're including some messaging if there's weekly newsletters that go out from leadership. Stopping in on to see folks. If you are in the building, put your mask on and just show your face every now and then from a distance, so folks know that you're still available and still there. And if you're virtual, make sure folks know how to get a hold of you if you're virtual right now.
I think those are all fantastic tips. And just talking about one thing that hit the news, I believe it was yesterday, today, is that OSHA is investigating it's a suburb hospital within the state of Georgia, and they're being investigated because unfortunately one of their nurses passed away after contracting COVID-19. The nurse had been an agency staff nurse and actually worked in several different organizations, so it's going to be difficult to trace the origin, but those types of situations will come up in the future. And I believe that the more organizations have their compliance reports in place, make sure that they're following protocol to the best of their ability, take the safety of their employees the utmost concern, we're going to all be able to protect each other a lot more. So I think all those points about being visible, being in communication with your employees, and always tracking things is going to be extremely important. Is there any other advice that you have for healthcare organizations right now from the compliance perspective and your role, before we shift into really talking about your other hat and what early careers should be thinking about?
No, I think the only other thing I just would love to touch on is this is also a time, and I'm going to put my ethics hat on for a second, when ethical leadership and decision making is just so important and so key, and that includes informed decisions that are value-based, beneficial, reasonable, systems focused, and most importantly right now, transparent. So, if a final decision is being made or not being made, explaining it to the best of the ability why that's the case. We know that staff is facing an incredible amount of moral distress as well as actual fatigue at this time, which means our attention spans are probably a little bit shorter, and we're, very hyper focused on things. And it's not that hard for the tone of a message to really just set stuff off. So making sure that you're consistent with your messaging, how often you're messaging, who you're making sure those messages go down to. If it's a trickle down message, how do you know supervisors are sharing that information with their staff? Are you holding town halls? Is it a safe place for people to ask questions? So just keeping all of those ethical leadership decision-making elements really in the back of your mind while you're doing this. In the long run, it may take a little bit of extra work, but it's going to have a better outcome in the future.
Yeah, I definitely think ethics is more important than ever right now. I know that we've talked about this before, that ethics is one of those classes whenever you're going through your graduate course that may be offered, and if it's offered, you don't necessarily jump to take it.
Yeah.
But whenever you're dealing with what we're dealing right now, and visiting social disparities of health as well as vulnerable populations and how you respond in a crisis, ethics is one of the most important things as leaders that we need to really make sure that we're always focusing on, and making sure that our informed decision making is always rooted in ethics is so important. So I'm glad you brought that up.
Yep.
And now, right now as an industry, we're having a lot of early careerists as well as possibly new managers, new directors that may have been promoted to their roles shortly before the pandemic, crisis hit. And whether they're early careerists and they just joined an organization January 1st, and or they're in a residency that just started, or they're a new manager and they're working remotely now, trying to navigate and figure out, what am I supposed to do? What advice do you have for them in the current pandemic? I know one of your roles is in the Early Careers Network within the American College of Healthcare Executives. You've worked at both a regional level with the Western Pennsylvania branch as well as at a national level. What advice do you have?
Sure. So first off, I think if we'll start with students and work our way up. So from a student perspective, students just coming into the industry right now maybe going, oh my God, what did I get myself into? Or going, yes, this is why I picked this career. I don't know if you're going to be in the classroom anytime soon. This may be a very virtual learning opportunity for a lot of individuals moving forward, but it's also a chance to hone a lot of communication skills. It's a chance to ask a lot of questions. Imagine you're taking your commute out, going back and forth to the facility that you would be learning at. So taking that time to use other available information for learning, investigating epidemiology more. I joked, Stephanie, with you previously that I was like, why do I have to take some of these core classes? And now I'm the one going, hey, you're looking at flattening the curve with the wrong data. And we've got to look at it this way instead. And it's amazing how some of that sticks to us. Statistics, epidemiology, all of those pieces. So really putting all of your effort into classes, even if you don't know how they might link up to your future career right now. Also, having awareness. This is a time, if you have the chance to sit back and watch what's happening, because things are going to start coming out with importance to you, like supply chain, like legal, like logistics, like public affairs. So all those positions that sometimes we're not really sure what all they do, that are looking so incredibly critical right now, that individuals are going to want to talk to those people down the road and say, how did you do this? Talk to me about lessons learned. Talk to me about the successes that you had. So start making a list of folks that you really want to reach out and spend some time to when the capacity to do that comes up. Offer to do a quick lunch and learn over the phone with them if you can. So there are ways to adjust to this that are good to have, or is not necessarily negative in this way. If you're new to your job, you just started January 1st and 2 months later, they told you to take your computer and go home, you're teleworking now, you may feel a little bit lonely. You may wonder, how the heck am I going to build relationships with individuals if I'm not physically face-to-face with them? If your company allows Zoom meetings or go-to meetings where you can have that screen time, I encourage you to take part in that. If you're not hearing from someone, don't assume they're ignoring you. Take that opportunity to reach out and just say, I'd like to check in. Maybe you feel like you're not doing enough right now. Identify what your strengths are and say, hey, is there anything that I can do? Can I take minutes for you on a call? Can I help build some guides that you're working on? Can I look into something for you? Do some research. So take that opportunity to diversify your position potentially. And then if you're in a position and you're like, oh my gosh, I don't even know what the next step is. This is a time where I think we really need to balance being slightly humble and knowing when we need to ask for help. There is someone there that can give you some type of advice, that can point you to some kind of reference. This is a chance where you can tell your boss you have 5 minutes, and you always approach it as what's best for the organization. So right now, I'm a little concerned about, which is the priority. Can we chat real quick about what we need to prioritize first so that the organization is functioning in the best way that it can? And then it's not so much about, oh my God, I need this, or I'm struggling, or I don't know what to do, but talking about potential solutions so that you can get that guidance and that recommendation. Mentorship is just so key right now. Reach out to your mentors. I've gotten so many emails on LinkedIn or personal emails just going, hey, can we chat? I'll take some time in the evening. I don't have a problem doing that. And there's not a lot of people who are going to flat out tell you no. They might direct you to someone else, but that's not a bad thing either. So just kind of keeping all of that in mind. And I think, this was something I had to practice today. It was like 10 o'clock and I was feeling like that gut coming up in my throat because there was just a plethora of emails coming in. And I had to take 5 minutes and go, this is going to pass. That this is a phase. This is going to end. We don't know what things will look like when it's all said and done, but we just need to take this breath by breath and day by day and do it to the best that we can. And there's no perfect answer right now. And I think as long as we aren't super harsh on ourselves as early careerists, we're going to be able to come out of this with a fantastic experience in regards to seeing how this developed and to be a part of solutions down the road and preparations to make sure that next time it happens, if it does happen, that we address it even quicker and in a better aspect.
I think that's great advice to everyone, not just early careerists. Right now, we don't know what's going to happen down the road. We can't predict the outcomes. We don't know what's going to come a week from now, 2 weeks from now. All we can do is learn, gather as much information as we possibly can, take all that information, all of that data, everything at our disposal, and react to solve the problem to the best of our ability. And I think, as healthcare leaders or early careers, if you do that every day, you're in the best situation possible. And to your point, this will pass. So every once in a while, take those breaks, separate a little bit, understand that you can only do as much as you can do, and just take that time to breathe.
Most definitely.
So do you have any advice, to some of the college, crowd? I know you touched upon that a little bit, is, there are people within the graduate program, they may have been slated to start in, September. They don't know if they'll be in the classroom or not. They might be going into their residency. And from a mentorship perspective, you mentioned reaching out. Is there anything else that they should be doing right now to make sure they're as prepared as possible?
I think it's a great opportunity to start reviewing your competencies. There's never a time that's too soon. There's a ton of competency opportunities available out there. If students are joining professional organizations right now at the student rate, the amount of free things you can access through those organizations is incredible. So fork over the $50 to join for a year and start now, getting in touch with those individuals now, looking through membership lists, going to webinars. There are so many things that I've been able to join in the last month or dial into after the fact, and listen to that weren't available when I was a student. So taking advantage of all of those pieces, and through that, identifying the competencies that maybe you're weaker in. And then that's your opportunity when the semester starts to talk to your advisors and go, hey, I went through this competency list. I scored myself. I'm weak in communications. Is there someone that, you think an alum of the program that's done really well in that area that you could connect me with and maybe I could talk to them about? Or maybe you're weak in finance. That's my weak area. I'd still look for a CFO to talk to, on a regular basis if possible. And having that awareness again. And thinking about creative ways to get the same education that you could have got. So, we know there's a ton of group work, especially in graduate school. And maybe you don't have the opportunity to do that group work now. So how do you adjust and still have that team building aspect and approach? and still work with real-time organizations. So again, it's how do you kind of navigate that conversation with a UPMC, with an AHN, and you have an idea of something that you kind of want to test and everyone's at capacity. So working with your advisors, again, these individuals are also adjusting right now. They're not in the classroom either. And, talking about things that you're really invested in, that you really want to learn more about, and how do you approach that? Odds are they probably have some connections with industry individuals. And if they broach that introduction, it's going to be a lot smoother for you. So to take advantage of that, but this is a time to learn, absorb everything that you can from a knowledge standpoint, and then practice it to the best of your ability with your peers or with others that you have access to. If you're in a residency that was supposed to start on May 1st and they called you and you didn't even get the 2 months that those people that got hired on in January did, it's literally come get your laptop and go home. This is the chance where you can really focus on picking up the phone to call people, not relying just on Skype and link messages or emails. Mastering the way that you write an email. All of those pieces are soft skills that get lost sometimes where we're thinking about how do we operationalize stuff here and now. And this is giving you a chance to take focus on that. So nothing is ever too small to look in on. And anytime that you identify that, take the time, kind of come up with a plan of how you want to address it, and then ask for help and ask for guidance. Mentorship, again, as I said before, is going to be huge right now because so many of us are in roles or reactionary areas that we've not experienced before. And maybe no one's really experienced all of this. The Spanish flu was 1918. No one's around that responded to the Spanish flu. But other emergencies, are very similar. So folks that worked through the blizzard of 2009, and had to work through those immediate changes. And yeah, that was only a week or two, but still folks took a lot of lessons from that. So getting in contact with people that have been through some really intricate emergency responses and getting to hear from them how this one's been different. Just outreach. Can't say enough for it.
Yeah, I think outreach is a great recommendation, for early careerists, early healthcare executives, et cetera, because there are a lot of things happening right now that if you simply just invite yourself to the table, you can listen in on and understand and learn. And there has never been more free information available in any industry than there is right now. And accessing all of that, whether it's through an association or online, through a law firm, through an accounting firm, I would register for anything that interests you and download the information, absorb it. And one of the things and recommendations I would give as well is that I think we're going to see a lot of evolving roles coming out of this response to the pandemic. And to your point, Natalie, right now, if you're interested in public affairs or foundation or supply chain, dig in and learn more about that. And I do believe that health systems and healthcare organizations, hospitals are going to have evolving positions that are going to really transcend, being a hospital executive or working in public affairs or public health, and really being something that combines all of those traits together to really help combat these types of situations and responses in the future. So I think as we work through this at the tail end, there are going to be new roles and positions, even at the manager and director level, that we didn't have before. And, to early careers, if you work to absorb all that knowledge, make it your own, understand it, and then figure out how you can help solve the problem for organizations in the future, you really make yourself indispensable. And that would be one of the recommendations that I have to everyone is just absorb, understand, and then see what you can do to help solve the problem.
Completely agree. I mean, how many years ago was my role compliance not, top of the tier, or patient experience officers didn't exist? And now we are just so critical. I think too, the industries that are going to come out of this that are healthcare related are pretty incredible as well. I think we're going to see a ton of innovation occur. So it's an opportunity for those that don't necessarily want to go work in a hospital to keep their eye open for organizations that are in startup functions, or they're coming up with very creative ways to make the supplies that are needed. When elective surgeries start back up again, all of a sudden, all those supplies we needed for elective surgeries will be needed. So, what creative things have been going on in the background that'll now all of a sudden come to the forefront. Our smaller hospital is going to pop up with 1 or 2 ICU beds that can be utilized versus pushing everyone into an urban city center. So roles are going to change, healthcare delivery is going to change, types of organizations are going to change. And it's really, I think, when this is all said and done, going to be a pretty exciting time to be coming into the industry. So it may feel very scary now. Your anxiety might be really up. But in the long run, if you can kind of look at it 5-10 years out, I think that you are in the midst of a learning experience that no one else has had. So embrace it as best as you can.
And you touched upon an important point there that I'm going to touch upon for a minute is, we're talking about the lack of beds across America in hospitals right now. And one of the things that has occurred is that there have been numerous rural hospital closures over the last decade. And, we're sitting at a point in time where there are a lot of rural facilities that are wondering how they're going to keep their doors open as well. But one of the important things is those rural facilities are an important component in our entire healthcare system infrastructure across this country. And as we look at the response right now, I think we're going to understand that having a few ICU beds in those rural communities is vital when you're going through something like this, because you really need to be able to treat those patients in the right environment and stabilize them before you transfer. And, as we think through that, there's a big talk about micro hospitals, and they're becoming more popular and popular. So if that's something that you're interested in as an early careerist, a micro hospital, and a critical access hospital have some similarities, but there are some differences as well. One of them, of course, is reimbursement, but also just the structure of what a micro hospital looks like compared to the more traditional hospital. Understanding some of those nuances and differences could make a very important distinguishing feature for someone coming new to the market. And as far as your point into new industries, there are so many that are going to come out of this just from the development in general, from the supply chain perspective and infrastructure. But if we look at the telehealth component and some of the monitoring devices, and what do you need to have in a patient's home in order for them to manage their cardiology symptoms, in order for them to manage their diabetes, in order for them to manage their healthcare if they're not leaving the home, all of those features, extending your iWatch, extending the remote monitoring, all of those are going to become more and more popular and feed in. So if you're interested in those areas, I think that's a great opportunity as well.
Oh, without a doubt.
So any lasting thoughts that you want to share? I do have one question from people that I've been fielding, and Brian may have a few others, but any lasting thoughts on early careers before we shift into questions and answers?
No, let's tackle some questions.
So I had one question from someone that works in compliance in a rural hospital, and you may have different perspectives, but what they're really asking is, what do you believe are the key priorities that someone in compliance should be thinking about right now? And more importantly, as soon as we start to move out of the initial response, what we would consider to be the heightened response, or where there are a lot of cases, into the secondary response where we might be planning for the next wave, what would you be focusing, or what are you going to be focusing on in your role?
Sure. So I no longer have privacy under me, but I think privacy is something key to keep a pulse on right now with some of the relaxation of HIPAA regulations. We know as compliance individuals, not everyone understands the nitty gritty of HIPAA. So folks may be like, oh, HIPAA's been relaxed. Well, not maybe as much as you thought. So I think that's something really to focus on right now because of the flow of information being so electronic and so fast, and folks are working from home. So I think with the telework piece, that there's a lot on the staff side that compliance probably needs to focus in on, in regards to making sure folks aren't using devices inappropriately, or how they're accessing information. Are they sending stuff to their personal email for some reason? So all of those pieces I think are important to keep an eye on. I also think that compliance should be shifting to a risk assessment, issue assessment type of approach. So this is right now, when things are happening, is the opportune chance to identify the gaps and controls that are currently there. So making sure that you understand what those controls should have been, or that there weren't any in the first place, and then immediately trying to put some mitigation in place for it. We know, and I've hammered home, that telehealth is going to be huge. So I think as we look at the shift out of this response, doing as much preparation as possible now with looking at how individuals are coding and billing telehealth encounters. Is their documentation appropriate to support the charges going through. Because when funding starts flowing in for that and copays start hitting patients, it's going to become a lot more important than right now when some of those issues are relaxed. So, are there providers right now that are being allowed to provide telehealth that won't if state guidelines go back into place? What kind of education needs to be done with folks doing telehealth that have never done it before, to ensure that they have understanding of what needs to be documented. So I think that that's probably one of the biggest areas of risk that is out there and that we should be focusing on. And like I said, some of those credentialing pieces and scopes of practice pieces as well.
I think that's great information, and that sort of feeds into the second question, and it kind of overlaps a little bit. But the question is, it's really difficult to stay up to date with some of the changing regulations that are coming out, and it seems as if the information changes daily. What do you recommend, and what sources are you going to really find the majority of your information right now, or what are some of the better sites to look at?
Sure. So any of the government sites directly, of course, that are doing daily updates to things is important to keep an eye on. What might work for some folks is if you know that there are 5 to 6 regulations, so Stark, HIPAA, specific telehealth regs, keep a little spreadsheet of that and track the changes that are being done. So as long as you can kind of feel that information come in, get the key changes to it, and then you're able to see how it may have changed over time, which to me is helpful, because if someone goes back, if you see a provider and they said, well, 3 days ago it said this, you can confirm, yeah, 3 days ago it said that. We've got to figure out how to get you the new information right off the bat. I think, the Healthcare Compliance Association has good resources out there if you belong to pull from there. State websites, of course, releasing information on the daily. You can set up a Google search, as simple as that, to look for news articles. So oftentimes what I find helpful is a news article that has like a little press statement in it that talks about the high level change. It's like the executive summary. So sometimes getting off of the very governmental legal websites and getting actually into a news media that has summarized, it provided the link to the summary. Not that you're taking the news media as the word, but it can drive you to the resource more quickly. So setting up one of those Google searches with key search terms, I think, is important too. You can quickly kind of glance through and make sure, hey, there's nothing in there I'm interested in, or yes, this is important. Utilizing healthcare councils that are available no matter where you're at. Any hospital associations, they're summarizing this information as quickly as possible too. So I think that there's a lot of different places to get your information from. When you find what works for you, just be consistent with it. And then, that also helps you knowing that, hey, I trust this resource and I'm going to continue to go to them for updates. I'm lucky in the VA, they provide a lot of stuff down through our, of course, the central office in DC. So we have a lot of stuff disseminated to us in a very summarized fashion that we can try to follow. And we receive guidance that way. But I can understand those frustrations if you're a one-man show in an organization out in the private sector and trying to keep all of that up to date themselves. But just know you're not alone. And I'm sure if you have some internal folks and peers that you work with, you can bounce ideas off them too and just kind of share back and forth.
Well, that's fantastic. Good information. We're coming up on our end, and just to make sure that I didn't miss any questions that haven't been fielded, Brian, did you see anything come through on your end?
Yeah, we do have one question that was submitted, and this is for Natalie. Natalie, in general, what advice can you give to organizations that may need to alter how they communicate the role of compliance in order to be proactive?
So I think first, I think first off, it's I have found, and when we're physically in a building, people don't know who we are. We have offices in the corner or the basement, or we might be bogged down and we don't get out a lot. If your compliance officer is willing to have their photo and their contact information blasted out to the entire workforce, I think that's great. And it's just kind of a reminder of, hey, if you have concerns right now in the midst of all of this that's going on about business operations or any of those functions, don't forget you have this person as a resource to reach out to that's separate from any other reporting line. And again, we tend to be, I don't want to say a negative, but a quote unquote punishment. You don't ever want to get turned into compliance, but we're not the bad guys. We're here to help support. So I also think messaging that comes down from leadership about, don't forget, if you're working on something new and innovative or a quick response, to run it by the compliance officer, invite them to the planning call, make sure that it just kind of gets the blessing and the sign off before we get too far down and we waste resources and realize that one of those regulations changed and we didn't know about it. So it's really that proactive approach, and it's that, we're here to support you. We would rather be proactive in that and help you work your way through things than come back after the fact and be like, oh my God, what did you do? We didn't know about this. Now we got to build audits. So being as real time as possible and making that compliance person, not the individual that when you get onto the elevator, you go, oh my God, everyone shut up. Natalie's on the elevator. But the person you say, hey, Natalie, so glad I saw you. I had a question I wanted to run by you. Do you have a second? And we can do that virtually too. So that's the culture shift that we want to see. And that's comes from communications and the tone from leadership in the organization.
That was a fantastic response. I think being proactive rather than reactive in all situations is always a positive move. And the more that we can do that in any organization, whether we're focusing on compliance or not, proactivity is always the best thing. So Natalie, thank you so much for joining us today. If anyone else has questions to ask Natalie, please feel free to reach out to her. Her contact information is on the slide as well as in the handouts. And also, if you have any questions for us on any of the other topics, please reach out. And we'll be doing this again at noon next week on Thursday. We'll be focusing more on reopening services and some of the service lines, as well as some more compliance related issues. If you have any questions related to your areas, please reach out in advance of that. We'll make sure we have your questions answered individually, as well as have those topics on all of our roundtables. In general, thank you everyone for listening. Please be sure to follow us on ALTIUS Answers on all podcast related channels as well as YouTube. And please look for us in our roundtable in the future. Thank you to your clients and listeners and the audience at large. And Natalie, thank you so much for joining us today. Your knowledge and information has been greatly valuable.
Thanks. It was great to be a part of it.
Thank you, everyone.